Go ahead.
Hi, my name's Catherine, and I was diagnosed with breast cancer in December 2009. I was initially going to have a lumpectomy and had my surgery date all scheduled, but a week before surgery I found out that I had tested positive for the BRCA gene, and so my surgeon wanted to change the plan. I asked if she had any recommendations for plastic surgeons, because I had decided, because of the increased, very high risk of developing a second breast cancer, I had decided to have a bilateral mastectomy. And she had a couple of recommendations, but she suggested that I would click with Dr. Davison, and I made an appointment. He saw me the next day, and she was right. I mean, we did click immediately. He was very warm, gave me all the time that I needed to ask all of the questions, and I had a huge ream of questions that I'd written down. I felt very comfortable with the options that I was given, and decided to go for implant reconstruction with expanders that would eventually be replaced with the implants. Sorry, I messed that up.
That's okay. That's okay. We can edit it, so it's okay.
Okay.
Yeah.
So I saw Dr. Davison and his team about 3 times in the week before surgery, and it was a flurry of activity because it was Christmas week. But I felt extremely confident going into surgery that I was in the best of hands. I woke up from surgery, and I never really experienced the although it was a difficult time going through having surgery for breast cancer, I never really experienced the trauma of waking up without my breasts, because that didn't happen. Dr. Davison worked alongside my breast surgeon, and when I woke up, the expanders were in place, and you know, my body just still felt whole. And I've spoken to a lot of other breast cancer patients since then, and I know that time can be traumatic, and I never experienced that. Dr. Davison and his team took great care of me recovering from surgery, and I realised later made a lot of small choices that made a huge difference to me and other patients. Things like the choice of drains that we used. I was nervous about having my drains removed, but I didn't feel it at all, because Dr. Davison chose a type of drain that is very easy to remove. The types of dressing that we used after surgery, I was able to shower immediately. You know, some of the other people that I met after surgery were, you know, it was 3 weeks or so before they could shower. So little choices, but makes a huge difference. I'm going to edit this part. I just need to check my notes.
That's fine, that's fine.
Okay. One thing I hadn't really realised before going through this breast cancer journey was your choice of plastic surgeon and team is so critical, because you end up seeing them more than anyone else in your cancer squad, more than your oncologist, more than your initial surgeon, radiologist, and I did have chemotherapy and radiation treatment too, but you end up seeing the plastic surgeon through the reconstruction process. So it's more than any of them. So it's really important that you're comfortable with your choice of plastic surgeon and also the team. Dr. Davison's team has always made me feel extremely comfortable. They're warm. The nurses are amazing, and also will talk to you and are very supportive of complementary treatments along with the traditional surgical treatment of breast cancer. So very open to all of that, which was very important to me. So I would highly recommend, I mean, and I have recommended Dr. Davison to a couple of people who've been diagnosed with breast cancer since my journey started, and if I had to go through this again, I would not hesitate at all to have Dr. Davison as my surgeon. One more pause.
Yeah,
See if
that's
there's anything I've forgotten. So overall, the whole process of being treated for breast cancer, which is a serious disease, really has not been traumatic at all for me, because I have just felt in great hands the whole journey, and Dr. Davison and his team have been a crucial part of that.
Thank you.